A new study reports women can slash their risk of ovarian cancer by more than 30% with the IUD. Researchers at the University of Colorado School of Medicine analyzed 11 previous studies to come to their conclusion. And for those that don't know this, ovarian cancer can be tough to treat, can be caught late, fifth leading cause of death for women here in the US, and 80% of cases are diagnosed at an advanced stage. So what I want to ask you is, when you look at a study like this, how might an IUD reduce risk, and should more women be using them?
Well, the researchers in this study thought that the IUDs were working one of two ways. There are two basic types. One type of IUD contains a hormone called progesterone, and it has an anti-estrogenic activity. So they're saying that anti-estrogenic activity may decrease the risk of ovarian cancer. The second type of IUD has no hormones, it's a copper IUD, and they're saying that that copper IUD may be causing some low-grade inflammation in the reproductive tract, and because you have immune cells just in the reproductive tract because of the IUD, those immune cells that are there are just fighting off precancerous cells.
So maybe that immune cell sees, wait, over here there's an ovarian cell that's a little bit off, let's go attack it and kill it before it becomes cancerous.
Yeah.
Has anyone ever suggested this connection before, or is this something brand new?
It's fascinating to me.
It's fascinating. So this was a study, and it hasn't necessarily changed how we're practicing medicine right now, but it's definitely an interesting study, definitely something to take into consideration when you're thinking about birth control. But just overall, IUDs are a great form of birth control. So to answer your other question, I do think that more women should have a conversation with their provider to talk about the risk and benefits.
As host of the show now for 12 years, there's been a lot of scenarios where it seems like an incredibly effective device, but is there still a lot of fear associated with it as opposed to just taking a pill?
You know what? The internet is an interesting place because it tells you, you go and you type in your symptoms, or you say, I have this thing, and they'll say, I'm sorry, you died yesterday, kind of thing. And I think a lot of people are afraid because of that. But there are risks and benefits to everything.
Absolutely.
So I'm not going to say that there are no risks to the IUD. It's 100% bleeding, infection, perforation of the uterus, which doesn't happen commonly for the perforation of the uterus, but it is possible. So it's about having a conversation. Some people are a little apprehensive, but a lot of good things can come out of having the IUD: control of your period pain, decreased bleeding, particularly with the progesterone-containing one. And these IUDs are about as effective as having your tubes tied. So we're talking about really effective birth control.
And, talking about reducing your risk by 32%, that's huge. And ovarian cancer is so scary, so hard to make the diagnosis. Any help we can get with ovarian cancer is huge.
Yeah.
So this is one to, when it comes to your conversation with your obstetrician gynecologist, talk to them about all the options, and this is something you could bring up as well.
Just to keep in mind that there was this study, and who knows, maybe this will revolutionize the way that we approach particular situations.
And really quickly, I have to touch upon this.
Okay.
We recently did a topic on our show where, particularly with emergency contraception, potentially not as effective in women who are overweight. Is that a conversation starter to have also in terms of now with the IUD study and knowing that maybe emergency contraception is not as effective?
Yes, and that's a great point because IUDs are great for everybody, regardless of weight, and they're so effective at preventing pregnancy, then that would be an ideal situation. And we spoke about, when we were talking about the emergency contraceptive, there is a decreased effectiveness with certain pills when you talk about emergency contraception, but you can also use a copper IUD for emergency contraception, so it will provide that, it can serve that purpose, plus you can keep it in to continue to have long-term contraception.
She's an obstetrician gynecologist. She's our friend. She's our co-host. She is Dr. Nita Landry.
That's why we asked the gyno.